I'm Marina Fredera. I'm the Trauma and Curriculum Specialist for Sunrise, and I focus on our social emotional learning, our literacy curriculum, and also working to help make Sunrise a more trauma-informed organization. Trauma-informed approaches do a couple different things. So they're more of a set of principles and mindsets that we can try to integrate into specific practices. So SAMHSA has identified 6 key principles of what makes something trauma-informed. So it's something that promotes safety, it promotes trustworthiness and transparency, it includes peer support and structures for peer support. There's opportunity for collaboration and mutuality. There's also an aspect of empowerment and voice and choice, and it takes into consideration cultural, historical, and gender issues. There's lots of different ways to do each of those 6 things in our curriculum.
At Sunrise, our approach is about creating a community mindset that promotes safety and resists re-traumatizing.
Things that recognize that trauma is real, avoid re-traumatization, and put things in place to prevent trauma. All of those are kind of a general mindset and approach to being trauma-informed. This approach lets us think of behaviors or student brain states and student bodies as either regulated or dysregulated.
It can be as simple as ensuring that adults and kids all have personal safety plans. It can be how we intentionally set up our spaces or design our schedules. And it can be including activities that help kids and adults to self-regulate.
So it's something that applies to everyone involved in a community. So it's not necessarily something we do with kids or for kids, like say curriculum, like we are teaching something the students are doing. This is more of a set of principles that applies to us as peers, between each other, as staff members, between us working with parents and caregivers, us working with staff members at schools, as well as us working and being community with students. So it applies to everyone in a community. So Sunrise has found a lot of success with the professional development we've been developing, and we want to share those lessons learned with others. We've noticed that a lot of training around trauma-informed practices is either way too broad or very clinical. And a lot of what we've learned and been able to teach our staff about is very specific to after school, specific to the frame of reference that after school professionals have, and is really easy to implement immediately after trainings. We've also been trying to work on making them ongoing. So recognizing that one and done doesn't really help folks internalize knowledge or change practices. Long-term benefits are just general well-being, being healthy. So students and staff who can more easily self-regulate, so that creates greater safety, that creates more time to do fun things as opposed to time around working to get folks back to homeostasis. And it resists re-traumatization, so there's greater chance of less harm being done in the future. We hope to see you at one of our trainings.